Hello friends, so we are back with the topic and our today's topic is treatment of the fractured tooth. In my previous seminars, I have already explained about Ellis and Davies classification. Here is the pictorial representation of the Ellis classification from class 1 to 9. So today I will be discussing the treatment
of each one of this in detail.
So Ellis class 1 is, as you can see in this picture, Ellis class 1 is when there is fracture involving enamel. Here you can see here the fracture is involving this part of enamel. So in this case what we will do, we will smooth the enamel and we will check the vitality after 6 to 8 weeks. Then this is Ellis class 2 where the enamel and dentine is involved. Here you can see enamel and dentine both are involved. So in this case what we can do, we can restore the tooth and check the vitality after 6 to 8 weeks. In case when the fracture is more deeper in the dentine, then we can do indirect pulp therapy. Then coming to the class 3 where the fracture is involving the enamel, dentine and the pulp. So in this case, since pulp is involved, we will do the pulpotomy and we will restore the tooth,
followed by crown placement.
Then class 4 is non-vital tooth. As you can see here, the pulp is dead and the tooth became non-vital. So in this case we will do the pulpectomy in primary teeth or extraction followed by space maintainer as required.
Then this is Ellis class 5 where the tooth is lost or avulsed from the socket.
And in this case we will check where the tooth is. We will take the radiograph to check whether the tooth is intruded, or we will do the chest x-ray to check whether the person has inhaled the tooth fragment or the tooth. Then coming to the class 6 fracture where there is involvement of the root, there is fracture of root. In this case we will check whether the fracture is apical, middle or the coronal fracture. In apical fracture we don't do anything and we check the vitality after 6 to 8 weeks. In middle and coronal fracture the treatment will be different. I will discuss in detail
in the upcoming videos.
Then Ellis class 7, here there is displacement of teeth without fracture. In this case we will observe the tooth, and if the displacement is interfering with the other tooth, we will extract the tooth. Then class 8 is there is fracture of crown in mass. There is complete fracture of the crown and the root is there. In this case we will check whether the tooth is tender on percussion. We will maintain the tooth by doing the pulpectomy of the tooth,
and later on we can do crowns, post and core and implants as required.
Then Ellis class 9 fracture, there is injuries to the primary dentition. The injuries to primary dentition can occur in different form. First is concussion. In concussion the tooth is sensitive to percussion. There will be tender on percussion. So in this case we don't do anything. We ask the patient not to bite hard from that tooth and we will observe that tooth. Second is subluxation. In this condition the tooth is loose and there is bleeding from the cervix. So we'll ask the patient to maintain the oral hygiene. We ask the patient to use chlorhexidine twice a day for 7 days and we will observe the tooth. Third is extrusion. In extrusion there is moving out of tooth from the socket and there will be elongation and crown will be displaced. We will take the x-ray to find out
the position of the tooth
or the total amount of extrusion. In this case we will stabilize the tooth by doing splinting. Then next is the lateral luxation. It is the most common in the primary tooth. Here the tooth is luxated and moved buccally, lingually, mesially or distally. In this case we will stabilize the tooth by doing the splinting of the tooth. Then next is the intrusion. In intrusion the tooth is moved inside the socket and if it is less than 7 mm, we'll leave the tooth for spontaneous eruption. If it is more than 7 mm and if it is interrupting the permanent tooth bud, we will extract the tooth. Then the coronal root fracture. In case of coronal root fracture, we extract the primary teeth. Then the alveolar bone fracture. Alveolar bone fracture, in case of primary dentition or the primary bone, will do the splinting, or because the bone is very soft and pliable,
We'll use the gunning splint to immobilize the fracture alveolar bone.